Good afternoon, everybody. Happy Monday. Thank you for being with us today. My name is Shayla Carroll. I am a clinician with NJ4S, and I'm going to be kicking off our Lunch and Learn series. This is our our fifth and last of our October Lunch and Learn series. So far we've presented on substance use, cannabis use, video games, gambling, and today we have suicide awareness by Frank Greenagel. So I'm going to kick it over to Brezhnev so he could read off Frank's introduction and we will get started.
Good afternoon, everyone. My name is Brezhnev Ibe. I, too, am a clinician here at the NJ4S Union Hub, and it's always my pleasure to introduce Frank, who will be providing his final installation in our series. Okay, so Frank is a clinical social worker who specializes in addiction and recovery treatment, PTSD, grief, and finding direction. He's currently licensed in New York, New Jersey, and Pennsylvania. He currently serves as the Director of Clinical Supervision here at Prevention Links and oversees the first New Jersey Recovery High School. He also established and runs the internship program here at Prevention Links. Frank also serves as an adjunct professor at the Rutgers School of Social Work. He drives back and forth to Albany a few times a month in order to serve as the head therapist of the New York State Troopers Employee Assistance Program. Frank has worked with teenagers for over 20 years. He comes from a legacy of educators. He himself was an English teacher at Elizabeth High School for 3 years, and there he created the adolescent outpatient treatment program at Huntington Drug Awareness. He ran the recovery house at both Rutgers, New Brunswick, and North for 5 years. Frank served the New Jersey Governor's Council on Alcohol and Drug Abuse from 2011 to 2022 and was the chairman of the New Jersey Heroin and Other Opiates Task Force. He served on the board of directors for Hazelden Betty Ford from 2014 to 2017. He also served on the National Association of Social Workers for New Jersey board from 2018 to 2020. In 2018, the president of the New Jersey State Senate, then Stephen Sweeney, appointed Frank to the New Jersey Youth Suicide Prevention Advisory Council. His use of profanity, his love of sports, and occasional frustration with humanity, and his background as a borderline juvenile delinquent usually makes him a hit with our crowd. So with no further ado, I'll turn it over to Frank. Frank?
Thank you, Brezhnev. Thank you, Shayla. Good afternoon, everybody. There's a couple of you have been tried and true and been with me for all 5 weeks. The Lunch and Learns with me are for this fall going to be concluded, but I know NJ4S Union County is going to be offering a series of other ones soon, and so I encourage you to take part in those as well, because we have a lot of knowledge on staff, and so it's a group that people should be pretty looking forward to learn from and excited by. All right, so I call this the destruction of community and the rise of teen suicide, and the reason why I call it the destruction of community is that there's a reason why the numbers have gotten worse. Obviously, this is my fifth one this month. As always, if you're someone who is a parent or a teacher or a counselor, or you work in a school or some other community program, and you're looking for extra help with the teenagers you're working with in Union County, please reach out to Nafisa Downs, the director of the NJ4S Union County. And we have a email address that a number of have access to, so you can reach out to request services, and those services could be some prevention work, some education work, could be individual and group counseling, diagnosing and assessing, and so feel free to use that as the latest resource that the state and the county are offering. So what I'm going to talk about today is, first off, I'll go through what teens are saying, what they're saying directly to me. We're going to review some data, which should horrify and alarm you. I'll talk about a book that's now 23 years old, Bowling Alone, and the work of Viktor Frankl is very important to me. I'll go through some articles and videos, and I'll put them, for those of you here, I'll put them in the chat so you can just kind of like cut and paste them, so you can take a look at them for later on. I'll talk about what you can do for suicide prevention and what you can do for working with suicide survivors. To be very clear, a suicide survivor is someone who has lost someone close to them. through death by suicide. I'll discuss some more resources, and I'll throw it open for a Q&A with some time left. Hopefully some of you have some questions or arguments or concerns or despair. So what are teenagers I work with, the students I teach, what are they upset about? So on the left-hand side of your screen is going to be kind of individual issues that they identify, and the right-hand side is going to be more global things that affect them but affect lots of people. So on the left side, romantic breakup. And teens, like adults, the number one predictor of someone attempting to take their own life is the end of a romantic relationship or some problem around the area of romantic sexual relationships. Family turmoil, school pressure, humiliation in front of peers. I have that in bold because humiliation is such a negative emotion that it causes people to act out in terms of, to act upon suicidal or homicidal thoughts. And again, humiliation, it's a loss of status in front of others. It's a loss of one's position within a community. You wouldn't believe how many young people I've have told me that they're not good at anything. And so having, whether it's a sport, whether it's drawing, whether it's writing, whether it's singing, whether it's creating something else, being good at something gives people a sense of pride, a little boost in confidence. And it's one of the reasons last week I talked about video games. One of the big allure for video games is that you can master a game fairly quickly by putting lots and lots of time into it. And people become immersed in them partly because that might be the thing that they discovered they're best at. And that's a hard thing to separate from. Obviously, other things that teens mention are problems with friends or lack of friends and too much screen time. On the right-hand side are bigger issues that we might think, oh, well, a 13-year-old can't be aware of it. Well, they certainly are aware of it, and things that they mentioned to me, excuse me, are climate change, school shootings, social issues, the idea that the best times are in the past, the fact that we're at endless war, the cost of education, going to college, going to grad school, getting professional training, graduating from high school or graduating from college and wondering, are they going to be able to get a job? Are they going to be able to get an apartment? Are they going to be able to buy a house? And the lack of healthcare and the lack of mental health treatment. Now, this might seem like a list that adults are talking about, but these are things that teens are very much aware of and have a sense of frustration and helplessness over. So what are some negative coping skills that people might use to address these things? Again, these are things that I've talked about. Substance misuse, I talked about on days 1 and 2. Gambling and video games, I talked on during the 3rd and 4th session. People also act out through engaging in shopping, spending money, whether they have it or not, acting out sexually, acting out through food. Teenagers also act out by committing crimes, whether it's stealing or simple vandalism, getting into risky situations, and being silent and isolating. So positive things they can do and that we can address are their eating habits, their sleeping habits, exercise. Are they playing sports? Are they engaged in any kind of art? Do they have therapy? Are they getting therapy? Do they have access to therapy? One of the great things about NJ4S is that we provide ready-made therapeutic services in individual and group format. Hobbies, family, stuff with family, stuff with friends. So these are all positive things, and but again, there's been a real decline on this. It's really been rocketed forward, made worse for these things since COVID hit in March of 2020. So let's take a look at some data. If we look at the total suicides in the United States over a 35-year period between 1981 and 2016, we see that there's been a rise to, and we're over at 50,000 now. We don't have great data for 2022 yet. Our data from 2020 and 2021 is very much been affected by COVID numbers and lack of workforce in places that were, looking at data. But the numbers have gone up to over 50,000. Now, You see that black line at the top is for both or all genders. But you notice there's a huge difference between males and females. That does not mean that females do not have suicidal thoughts or engage in suicidal gestures or dying by suicide. Men are much more likely to complete them. We'll talk about that. So, and this data holds true. It's about 3.5 to 1 ratio for adults. Men to women, it's about 2.8 ratio for teenagers of males to females completing. Here's another graph looking at the increase. Same data, just a different way of looking at it. Death per population, males continues to go up, females continue goes up as well. This takes it, the last graph went to 2016, this one went up to 2019. We look at some jumps here. As you can see, there was a huge jump in 2008. Anyone want to take this is not a rhetorical question, anyone want to take a guess as why there was such a huge increase between 2007 and 2008? And again, generally we're seeing a steady increase year by year by year, but 2007 to 2008 we saw a particular big one. Any guesses as to why?
I'll guess was it the economic crash or crisis?
You are absolutely correct. You are absolutely correct. Good job. Yeah, it was the economic crisis. Obviously, when things are when people are having job and financial problems is one of the top 5 predictors of someone having suicidal thoughts. So going across the age spectrum, the number one predictor of someone completing suicide is having a romantic relationship problem. It's over 40%. After that, there's drug and alcohol use, of course. There is a mental health issue. There could be legal issues, there could be health issues, and job and financial are kind of like the really big predictive factors here. If we look at it by state, we've seen that every single state in the country between 1999 and 2016 saw an increase in suicides. Now, you might see like there was a decrease in Nevada. I don't think because Nevada, which has Las Vegas and Reno, really know what they're doing. I think it's probably because they had very poor data collection. And so don't think that there's like the answers there far out west. The one thing about this that's fascinating is that we see a higher increase in suicide in that period in states that are colder and darker. There is an environmental piece to this. Less time outside, less time in the sun, more likely to have suicidal thoughts, more likely to have suicide completions. So does it mean that, if you're living in northern Maine or northern Montana, you're in a lot of trouble? Well, there's higher risk factors for sure, but the part of any treatment, whether you live in wherever you live, including Union County, New Jersey, is making sure people are getting outside and making sure people are getting sun. That does not mean that, okay, we're not going to do any other programming then. We're not going to put people on medication. We're not going to give them counseling. We're not going to, encourage community events. We're just going to have them go outside. No, certainly not. That is just one of many pieces that I want people to be aware of. So let's break down the youth. Let's break down youth. So what we consider youth is 10 to 24. We look at 10 to 14 and we see that number from 2000 to 2016 has gone up. Just kind of mind-boggling that people that age would consider really any age, but man, like at that age. We're looking at the 15 to 19-year-old population. That one's actually increasing the most. You look at that 2015 to 2016 jump, that's quite a big one. And then the 20 to 24-year-olds, that's continued to go up as well. Now, traditionally, young people are not the group that attempts or completes at the highest rate. The group that attempts or completes at the highest rate is 35 to 54. But the group that is seeing the greatest increase year by year in the last 10 years are youth. That 10 to 24, that group is increasing. Again, this was a National Center for Health Statistics. As you can see, same thing, 10 to 14, between 2001 and 2017, just about doubled the rate. And you can see, again, that 15 to 19 group is, while it's below the average overall, because the average overall is going to be brought up by people in middle age, we can see that their numbers are increasing quicker than all ages. So we've talked about age. Let's look at race. The race that completes suicide the most in the United States is white people. The only group that even comes close to dying by suicide are Native Americans, and then down near the bottom of the graph you see Asian, Hispanic, Black, and other. Now, two things here. One, this is literally the only health chart in the United States where minorities have better outcomes than white people. I do not want any takeaway from this to be that therefore we are not going to focus on youth minority suicide ideation or attempts or completions. I'm really interested in data as someone who's quite involved in public policy and public health, this is being instructive. Now, if we break this down among teenagers, though, what we're seeing is we don't see this disparity. White teenagers still attempt and complete at a higher rate than Black teenagers and Hispanic teenagers and Asian teenagers and mixed teenagers, but those numbers are disturbingly narrowing, and they're very, very close. And in fact, Native American teens actually have a higher rate of completion of suicide now than white people. So we're seeing a real change in that. Again, this is just kind of presented again, suicide rates by ethnicity, and as you can see, this one goes into 2020, and this chart argues that Native Americans and Native Alaskans actually have a higher rate than even white people. This is the last graph I'll show you. They're all disturbing. But if we compare the United States to other industrialized nations in the West, you see that while their numbers since the year 2000, their suicide rates in every single country have gone down. The suicide rates in the United States have gone up over 40% in a 20-year period. While the world can be a stressful place, we're finding that there is a particular soul sickness in the United States that's making this ever more pronounced. Another really disturbing aspect about this is that the United States, across the board, is the richest nation in the history of the world, and so you have a country with so much having such high levels of despair and such suicide rates. So again, all these graphs are disturbing. But this one feels very isolating, that the US is going through stuff that other countries that are well off are not. Okay, which brings us to the book Bowling Alone. Bowling Alone was an article written in 1995. It became a book in 2000. So bowling. In the 1950s, there was these bowling leagues all over the country, whether you're wealthy, middle class, lower class, working class. A lot of people are engaged in community events, including bowling. And so people would go and get together after work or after school and bowl together. It's not so much about the bowling, it's really about getting together with other people. So this book, written in the 1990s, published in 2000, talked about bowling alone, engaging in activities without other people. So he wrote about the decline in social capital, how people are becoming more and more alone, more and more lonely, that people are, in 2023, in 2000, he was talking about how people are less involved in community organizations. This has only gotten far worse in 2023. People are not going to religious services, and I'm not pushing people to go to religious services. It's just one of many things that people can go to have a sense of community, and that people have less and less human contact. This has led to a number of problems, including distrust in our institutions. You'll see people complain about the media, complain about schools, complain about colleges, complain about the police, complain about the healthcare system. I mean, over and over and over and over again. And you see distrust in institutions across the political spectrum. Now, people on the left-wing side of the spectrum tend to distrust different institutions than people on the right-wing side of the spectrum. But all of them have increasingly levels of distrust that were not there, that were much lower in the 1990s and were much lower in the 1950s. The book does not cover kind of fear-based politics, does not cover the rise of internet, does not cover home entertainment, does not even get into alcohol and drugs, all of which have added to social isolation. And obviously, it did not cover COVID, which added to this as well. And so we have a book written in 2000 about the decline in communities and social capital. And then the last 23 years have been bowling alone on steroids with fear-based rhetoric, with iPhones and Androids and other smart devices, smartphone devices, social media, proliferation of alcohol use, marijuana use, prescription painkiller abuse, heroin and fentanyl, and then COVID, locking people down, having people have less and less contact with other human beings. So how do we measure social capital? So two things should be going on right now. So dual processing should be happening right now. You should be thinking about your own lives, and you should be thinking about then people you might be working with. And so I want you to think about, who do you have meals with? Do you eat by yourself? Do you eat with family? Do you eat with a significant other? How often do you get together with friends for breakfast or lunch or a dinner? Who do you spend time with on the weekends? Is a lot of your catch-up phone or text or social media? Who do you have regular meaningful contact with? Do you have teammates? Do you have fellow, again, religious parishioners? I really think close connections can really be defined by that you're grabbing meals with someone, let's say 4 or more times a year. Now, there's more defining factors, but I think about that. People are like, well, are they friends? I'm like, well, I'm friendly with them. I'm like, well, do you get together for them for lunch or dinner? That's a different situation. Then we have social connections. How many people do you talk to at work or school or in your religious organization or clubs or teams or the community organizations? And most American social capital has gone down. It certainly went down during COVID. My work has been really influenced by an Austrian Jew by the name of Viktor Frankl. He's long dead. He was a Holocaust survivor. He was a neurologist and a psychiatrist who created something called logotherapy. He wrote a book called Man's Search for Meaning. You do not need to read it. In it, he talked about two things which were really important that he noticed for people surviving the concentration camps, and that was that the people that did well there had a sense of purpose, and they had other people they spent time with. So whenever I work with a new client, I try to find out, do they feel a sense of purpose in this world? And what communities are they part of? Who do they have? And almost every single person that is abusing drugs or alcohol, that has some trauma, that's expressing symptoms of depression or anxiety, they're usually lacking one, if not both of those. Purpose and community. There's that community again. All right. If you do not know, you need to know right now about 988. 988 is a number you can dial like 911. Very easy to remember. No 1-800-suicide hotline, just 988. It's in every single state. It's a nationwide number. Not only can you call it, you can text it, and it's available 24/7. And so we want to push this as much as possible. If you are here, you either have a personal or professional interest in this, and you want to put 988 signs all over the place to let people know that there's help available. And the reason why they came up with 988, it's very easy to remember. All right, I am going to put some article. I'm gonna put these in the chat. I'll go through them, and then I'm gonna put them in the chat. I wrote 3 pieces on suicide that I recommend, that I suggest you read. I'll talk about. There'll be little aspects of them. There was a very good piece in NewJersey.com last March about youth suicide in New Jersey. It's very, very well done. There was a really great piece in the New Yorker from April of last year about the rise of child suicide. With child, we're not even talking about teens. We're talking about 10 and under. There was a documentary in September 22 called Facing Suicide. Again, that's free on PBS. So I really recommend that as well. So you want to get as much education and information as possible. Share this with your loved ones. If you are a practitioner, you really should have this as part of the background floating around in your head. So some prediction factors. There is the suicide domino theory. The suicide domino theory is that if you know someone who completed suicide, that you are much more likely to attempt it yourself. Now, if you know someone and they're a high school classmate who you talked to a couple times, that still is part of the suicide domino theory. You knew of somebody. Now, if that was a college roommate who you lived with for 3 years, that's someone you know also, but that's someone you're much closer to. These things also happen in clusters. So there was a Marine I treated several years ago, and 13 members of his battalion who deployed in Iraq completed suicide within a few years of coming home. And so we have that's this huge domino thing where, someone knows 1, 2, 3, 4, 5 people, and it makes it more natural, more acceptable to them to attempt or complete themselves. One of the great predictive factors is gun ownership or gun access. We'll talk a little bit more about guns in a little bit. Other things that pop up, again, I've already talked about this, depression, alcohol misuse, other substances misuse, job and financial problems, end of romantic relationship, which is actually the #1 predictive factor, divorce, separation from children. So these are things that I just, I want you to be aware of for prediction factors, because we're going to look at this later as one of the solutions. Some symptoms, I'm not going to go all of them, but ones I want you to be aware of for teens is not interested in activities or disengaging from activities. They're quitting sports, they're quitting clubs, they're quitting music, they're not doing the things they used to do. They talk about being a burden, how they're very hard on their family or their significant other or their friends, or that people would be better off without them. You notice a change in sleep. Now that one's tough, right? Because teenagers have weird sleep patterns to begin with, but you should be aware of change in sleep. Here's that socialization again. Less meaningful contact with friends, family, and pets. Socially isolating, withdrawing from the world. And of course, any talk about suicide or dying, any regret for having ever been born should be taken very, very, very seriously. So there was a woman by the name of Jen Hecht who wrote a book called Stay about the case against suicide. And I've used this in a lot of my suicide presentations, and it's been very, very effective. Now, the #2 one is that it portrays your future self. So let's say 2020 was awful, 2021 was awful, and here we are in 2023, and this is awful. So you're like, I've had an awful 3.5 years. Why the hell should I stay alive? Well, maybe 2027 is going to be amazing. You just have to get there. You just have to hold on. So the idea here, one of the things that we push forward is that just because things are bad and seemingly have been bad for a long time, does not mean they're always going to be bad. And there's a lot of people who attempted suicide. Their attempt did not work and they lived. And then years later, they found happiness. And they have said, I'm really glad I didn't kill myself because life is pretty good right now. But that #1, that it hurts family, friends, and community. I am a survivor of suicide myself. It is horrendously painful. I lost a friend, not a family member, not a romantic partner, and losing a friend to suicide was enormously painful, shockingly so. I describe it as like a nuclear bomb goes off in your life. So I was doing, I've done a whole number of suicide presentations in the military. I was deployed to Poland in 2019. I gave several suicide presentations, and there was a number of people who came up to me afterwards who said they were really contemplating taking their lives, and that it was mind-blowing to them that their family would be worse off. Their idea was that if they took their lives, their family and friends would be better. And so the fact that I told them that I have worked with all kinds of suicide survivors and that they are devastated and communities are devastated by people taking their own lives, they were very, very surprised to hear that. The idea that their spouse, their kids, their friends, their job, their colleagues would suffer. Because one of the things that happens with suicide is that like people won't miss you, they'll be better off. And so what we want to do is really explain to people, people will miss you. They will not, they will be worse off for your death. You will cause an amazing amount of pain. It's a very important message to get across. And I know for a fact it's effective because I've had so many people tell me that that steered them around. Other things with suicide prevention is you want to look for symptoms, the ones we just talked about. To be very clear, you need to ask the question, are you thinking about killing yourself? Do not beat around the bush. Do not use a euphemism. Do not say, are you thinking about hurting yourself? Because many people who are contemplating suicide do not view that as hurting themselves. They view that as helping themselves. So you must say, are you thinking about killing yourself? Decades ago, people were afraid to ask that question because they were afraid that it would put the idea of suicide in someone's head instead of letting them know that you're paying attention and that you care. So, which is wild. You want to let other people know. So if I talk to someone and my radar kind of goes off, I'm concerned about the symptoms they're showing, it's not for me to hold. I need to talk to other people. We should contact social services. We should talk to their family members. We should refer them to social workers and mental health counselors. We want to get as many people involved as possible. So if someone's expressing suicidal ideation plans, that is not something that you should hold on to. That is something that's like, oh, don't tell anyone, I'm thinking about doing this. You need to tell a lot of people. You want to get people involved. We want to get the whole community around this person and as many resources as possible. Some solutions that the Center for Disease Control suggests. We need to provide temporary help to ease unemployment and housing stress. How does that affect teenagers? Well, teenagers live with people who are unemployed or people with housing stress, so that's a big thing. We need to have better healthcare systems, options for phone and online, offer treatment options by phone when in-person services are not available. One of the nice things about NJ4S is that people can do in-person or phone or Zoom or services like that. That's why 988 is there, though, to get people to plug people in as quick as possible. Communities can offer programs and events to increase a sense of belonging among residents. Really, really big deal. And schools can teach students to manage challenges like relationship and school problems. Some problems and solutions for you to think about. These are all micro level, but I want you to be aware of. So students express issues with grades and AP courses. There are some students who feel like complete failures because they're not doing well in school, and some of them are maybe really trying hard but not doing well. There's others who are not trying at all. On the flip side, I've dealt with a lot of kids the last couple of years from well-off families where they don't have the issues that children from working class families are going through, and the kids feel tremendous pressure in taking 3 or 4 AP courses. I'm someone, despite being a former high school teacher and helping run a high school now, and being a college professor and graduate school professor for many years as an employer and someone who supervises all kinds of interns and hires people, I do not value AP courses at all. I tell principals that, I tell superintendents that, I tell parents that. I do not view AP courses as a value add. Now, the one circumstance where I can see it be helpful is if someone's just from a very, very poor community, and if they can get 15 credits of college done in high school and save a semester of tuition, that I get. But for anyone else, it does not make sense because, and no insult to high school teachers, but a high school teacher teaching sociology does not understand sociology as well as a college professor. A college math professor is going to do a much better job at teaching calculus, or a college science professor is going to do a much better job teaching chemistry than a high school teacher. Again, no disrespect intended, but that's very, very clear. The other thing is, what the hell is the rush? You know, unless money is a huge factor, go to school and learn from someone who really knows your subject and enjoy your time there and develop your skills there. But the fact that I have high school juniors and high school seniors who are super stressed out and showing all kinds of symptoms of depression and anxiety because of their 3 AP courses they're taking, mind-boggling. Isolation. People are spending so much time on their phones by themselves, social media by themselves, video games by themselves. I'm hoping at some point that one of our NJ4S staff members will have a presentation on social media. I expect we'll have something like that coming. The data is very clear, though. The more time people spend on social media, the more likely to have symptoms of anxiety or depression and lower life satisfaction. Bunch of people get put on medication by their primary care doctor without proper diagnosing and therapy. Obviously, family turmoil and substance misuse. What are some solutions? Sports are a great way to help combat depression, anxiety. People who are involved in athletics are much less likely to contemplate, attempt, or complete suicide. That does not mean all of us can probably think of some examples of high school or college or professional athletes who took their lives during or after their athletic career, but by and large, sports is a huge positive. Before, a few minutes ago, you all heard me talk about how teens complain that they're not good at something. And so helping people find something that they're good at least one thing to hold at. If you're good at a bunch of things, much, much better. Physical activity, taking part in clubs, having friends, meaningful time with family, not, eating a meal in front of a television or everyone kind of just ships passing the night, but meaningful time spent together. A positive connection to an adult, could be a family member, could be a teacher, could be a counselor, could be a coach. Having at least one positive adult in their life for a period of a year or more is a big deal. Religious services, pets, having an orientation toward the future. We get to some macro level solutions for those who are thinking like, well, what can I implement? Limit access to guns. One of the reasons why men complete at a rate of 3.5 to 1, boys 2.8 to 1 is that they either own guns themselves or they know where they can get a gun in their household, and that gun may not be securely locked up if it's a gun that's obtained illegally. So really limit access to guns and increase gun safety education courses. Education about medication storage and access. So women are much more likely to attempt to take their life through poison or excessive medication. And so what we want to do is make sure that families that have medication in their household, that it's not just in a medicine cabinet, that it's not just in a drawer, that it's locked up so people can't just go, accessing it when they're feeling distressed. Community programs, that's the third or fourth time I've talked about that today. At the Recovery High School in Union County, which Prevention Links oversees, which actually is in Nafisa's division. 3 of our workers took 6 students bowling this weekend, and I saw some pictures and videos of that. And that is a community program to enhance, instead of the kids just sleeping or using substances or just sitting in their room on their phone all day, get them around other people, doing some activity. I don't think bowling's this great big physical activity. Some people who are bowlers might say it's great exercise. I don't really want to get into a debate with you about that, but I think it's walking around and moving and throwing something for a little bit is a really good idea. We need as much training as possible for people who are working with teenagers on this. We want to continue to reduce the stigma of seeking help. Going to get therapy in 2023. It's actually something considered a real positive, and it's been quite fascinating reading stories about how a vast majority of Americans would prefer to date someone who has sought or is currently seeking therapy, that is working on themselves. It's almost become like the latest status symbol of dating. Are you doing it just to improve your dating options, or are you doing it because you're actually wanting to work on yourself? That still said, there still is a stigma about seeking help. Just a point for everybody on this call today with me in person, or for even maybe some of you watching this down the road. People in helping professions are often very bad about asking for help themselves, and so it's something to be mindful of. You should try to promote 988 as much as possible, and with the data I gave you before, use risk factor data. Age, gender, race, issues, again, that romantic relationship piece, financial stress, substance misuse issues, isolation. You should think about helping to micro-target people and populations that are higher risk to do outreach work beforehand. So there's all kinds of different suicide assessment tools out there. I really like 3 basic questions when I meet with someone who has expressed suicidal ideation to find out how much further do I need to go here. Because again, Americans are also as much as Americans are increasingly suicidal, as you know, especially compared to the rest of the world, American language is also something that is very, very extreme. And so people will say like, oh, I wish I were dead, and now they've got to go get a suicide assessment and maybe go get hospitalized. And so are they using extreme language, or do they actually have suicidal thoughts? So one of the things so 3 questions I'd like to ask is, who do you care about in this world? And if people mention a family member, if they mention a friend, if they mention a pet, that's great. Because if you're connected, you're much less likely to actually do this. The other thing is that if someone does express connection, you want to tie it into who would take care of your puppy, who would take care of your younger sibling, how would your friends deal with this, you know, how would your parents, how would your grandmother, you know, handle you going away, you dying. What activities do you enjoy doing? Is there anything you like doing in this world that brings you pleasure? And then what do you want to do in the future? Is there something you want to learn? Is there a place you want to visit? Is there something that you want to experience? If people have answers to all these questions, there's people they care about, there's stuff they like doing, they're future oriented, their suicide risk is much, much lower. If you have someone who's like, yeah, I don't have anyone I care about and there's nothing I like to do, and no, I'm not thinking about anything past, you know, Wednesday, that's a very scary situation because they don't have any kind of protective factors. These are all huge protective factors that are really easy. Once you have these questions in your head, it's really easy to assess. For suicide survivors, I mentioned before, I'm a suicide survivor. When we lose somebody we care about through a natural death, maybe even a homicide or an accident, we experience sadness. Through homicide, yes, we'll experience anger as well. But through suicide, we experience sadness, anger at the person for doing it. And being angry at a friend for dying or a loved one for dying is a really rough place to be angry at someone that we're trying to mourn. Most people who are the survivors of someone else's suicide have a sense of guilt. I should have seen something, I should have said something. And then people are often confused why they did it. Even if there's a letter, even if they have all those risk factors, they had health problems, they had legal problems, they had financial problems, they ended a romantic relationship. So like, yeah, but lots of people have those things and they don't take their own lives. So why do they do it? And this is very complicated grief. Having sadness, anger, guilt, and confusion, really, really hard to process. Almost every suicide survivor I've ever met has spent a lot of time trying to figure out why do they do that. And I'll give you an answer, which is not the answer why, but I'll give you an answer to this, is that no answer that you can get will satisfy you and make you feel better about why they did it. And yet people over and over and over try to figure out why. If you ever hear about someone dying by suicide in the future, do not ask others, well, how'd they do it? You don't need to know methodology. And the person who's grieving shouldn't have to feel like they have to give a police report to you about like how they did it. People often say this is the guilt, I should have seen something. My friend had an interaction with a security guard a few times, and when I saw the security guard a few months, like a month after he completed suicide, the security guard says like, you know what, I thought about it, he seems a little weird like the last time I saw him. And I'm like, dude, it's not on you. Don't, you know, it's just stunning how people take on this guilt of it's my fault the person did it. And then number 4 is something that I thought about a couple months after my friend died in March of 2018, and that is, what is wrong with me that he did this? And the answer to that is that there's nothing wrong with me. His suicide was not about me. But you can see how people feel this way. If you're in a romantic relationship and your romantic partner takes their life, I absolutely understand why someone would be like, what does it say about me that this person I love took their life? Or What does it say about me that my dad killed himself? Or what does it say that me about my daughter killed herself? Those are very, very difficult things that need to be processed. So this is the flip side of suicide. All right, there's some additional resources here. I mentioned 988. There's the New Jersey Hope Line. There's Hope Rising. There's the National Center for Suicide Prevention Resources. So I'll open up the questions in a moment. I'm gonna close this screen. I'm gonna stop sharing, and I'm gonna put a bunch of articles in the chat for people. Obviously, if you're watching this online, you can pause it and look at the articles yourself. So Americans are completing suicide at a much, much higher rate than any other industrialized nation on the planet. We're having a collective reaction to a stressed out world. There's the items that I mentioned in the beginning that teens are talking about in their personal lives in the greater world. I can't stress enough the importance of physical activity to help people fight off these thoughts and feelings of suicide. Also cannot stress enough the importance of individual and group connection, a community. People with a community are much less likely to attempt or complete suicide. So, but part of that is if you are working with young people, if you have young people in your life, if you're a parent or grandparent or aunt or uncle, whatever else, think about what are you doing to show that you are a part of communities? And are you someone who does community building and foster building? I am someone who's very fortunate that I am part of many communities, and I am someone who fosters and runs a bunch of my own communities as well. And so that interconnectedness is a very, very powerful suicide deterrent, and it's a very strong sign of positive mental health. Okay, so I will open up to questions, comments, suggestions, concerns, arguments, breakdowns, and hope. If I thought this was hopeless, I would not be doing this work. I would just kind of give up. I think it's a really alarming situation, obviously, but I don't believe things are hopeless. So I will turn it over to anyone. If anyone has any kind of questions, and if you don't have anything, that's okay.
Hey, Frank. This is not Natalie. We're sitting all in the conference room and watching the webinar. My name is Safa Basadik. I'm a supervising prevention consultant. I have a question/comment. When it comes to the rates of suicide in industrialized nations, with the U.S. being the highest, ranking, what is the research, if you know, on unindustrialized countries, I guess? And do you think it's because other countries have higher, focus on community? What do you have to say about that, I guess?
So, a lot of times you'll see industrialized nations compared to each other because they have certain standards of education, certain standards of healthcare. What we call second and third world countries, there's not rigorous data collection, so we don't know what the numbers are. But that said, suicide is primarily a thing of richer, well-developed countries. Yes, you could argue I think there may be something to that. Poor areas and areas with higher levels of poverty, or if not poverty, of lack of funds, people have to be more reliant on each other because there's just no choice other than communal living. And one of the very paradoxical things in the 21st century is that the wealthier nations have much higher reports of depression, anxiety than poorer nations. I don't want to say this is like a made-up thing for rich people or well-off countries. It's certainly not. But there seems to be a trade-off between losing, having more greater financial sense and losing community. than the poorer countries. But again, the bigger thing is, this thing very may exist in sub-Saharan Africa, or parts of rural China, or really rough parts of India. But I think that even when we get data for that, we're going to see that it's just much higher in well-off areas.
Thank you.
Okay, if no one has anything else, then I will throw it back to Brezhnev and Shayla. For those of you who are just here today, or for those of you who are with me 3 or 4 of the 5 Mondays this month, I appreciate you for coming on. There's records of these, and so you can always access in the future. And you'll be receiving notices about future NJ4S lunch and learns. And I really encourage you, to access them or to take part of them as they happen live. So thank you all very much. I'm gonna throw it back to you too.
Thank you, Frank. So thank you everybody for joining us. Like Frank mentioned, these are recorded, so you can find them on the website. And if you need any information about that, just reach out to Nafisa. This wraps up our October Lunch and Learn series. And as it was mentioned, we're gonna continue doing some presentations. There are more presentations coming your way through NJ4S. Thank you all for coming. Thank you all for joining this series.